Hello, this is for Trach Cares. This is where we would want to check the patient's chart, make sure that we know what kind of tracheostomy they have, make sure we're going to the correct patient room, the patient with the trach, and we'll do some trach care. So we go to the patient's room. Hello, Mr. Blank. My name is Tricia. I'm with Respiratory Care. Today we are going to clean up the area around your trach and replace your dressings, get that cleaned up. We're going to check for any redness, swelling, or drainage. We just like to take a look at that site twice a day while you're with us. Do you have any questions for me regarding this procedure? Okay, can I get your name and date of birth? All right, before we get started, I'm going to go ahead and wash my hands. I would wash my hands, make sure I have my kit with me. We will go ahead and get all of our kit supplies. With the kit, we are going to have our 4x4s, our sterile drape. We're going to have our peroxide mixed with normal saline or sterile saline, distilled water, and then we're going to have another area, another little cup with just the distilled water or the normal saline so that we can rinse the area. So we have all of our supplies ready. So we are going to go ahead and get our kit open. So we have opened our kit, and we're going to apply our gloves. We would also have a suction set up near the wall. We are going to suction the trachea before we begin. We've gone ahead and put our gloves on, and then we would connect our suction tubing. We would have done that previously, but you have your tubing. And Mr. Blank, I'm going to go ahead and suction that trachea first. We're going to clean all the debris and extra secretions out of there. So we've gotten that done. We would discard that. Then what we're going to do is we're going to remove your existing dressing, and we're going to go ahead and clean that area. So I would undo the ties. This is just a pretend tracheostomy here. We're going to keep one finger on that trach at all times so that there's not too much movement. We don't lose the place of that. Prior to doing this, Mr. Blank, I would listen to your lung sounds, check your oxygenation level, just get a good set of vitals before we do this procedure. So then I would go ahead and remove the inner cannula. If it's a disposable one, we would throw it away, have a new one handy, put the new one back in. If it is a non-disposable one, we're going to have an alternate one available to us. We're going to remove the existing one. We're going to clean it off. This is where we would use the peroxide mixture. We would clean the outer and the inner area of the cannula. We would set that on a paper towel or something to let that air dry and still the new one in there. And then we're going to go ahead and clean the stoma in and around. So you have Q-tips. I'm going to go ahead and clean the areas here, and we would clean on each side, replacing the Q-tip with a clean one each time. So we're going to do all four sides, and this is going to be that hydrogen peroxide water or distilled water mix. Go ahead and clean that. If there's any visible debris on there that the Q-tips are not getting, we're going to go ahead and use that brush very gently around that area. Then we're going to have other Q-tips that have just the sterile saline or the distilled water on them. We're going to do the same process again. We're going to rinse off that peroxide. That peroxide can be irritating to the skin, so we don't want to leave that peroxide on there. Done all the sides there. Okay. So then what we're going to do is replace our dressing. Here we have a 4x4 that is previously cut, pre-cut. So Mr. Blank, we don't want to use just a regular piece of 4x4 because if we cut this with scissors, we're going to have little straggly strings that come through, and we don't want those strings to get down into your airway. So we use that pre-cut. We secure that around the stoma site there, make sure that's secure. And then we're going to remove the old ties, and we're going to place a new tie underneath here, and then we're going to secure that again. We're going to make sure that that's nice secure fit. Mr. Blank, do you feel like that's too tight, not tight enough? Okay, good. Do you feel like that's typical for how you've had it? All right, and it feels pretty secure. Then you would listen to your lung sounds again, assess the airway, make sure they're not having any difficulties, get their oxygenation or get the SpO2 level, check their oxygenation. Is there anything else I can do for you before I take off here, Mr. Blank? Okay, thank you.